So, last week I showed that we are starting to see what looked like perhaps the start of a decline of cases in the province. And fortunately, that does seem to be sustained. We do seem like we have probably peaked as of about 10 days ago and are now on a downwards trajectory. The one thing I do want to highlight here is that if you look at how steep the line was going up and how steep it is coming down, it's much less steep coming down. So this probably means we're going to take longer to get out of where we are than it took to get into this current situation. Looking at Niagara, it's a pretty similar story. About 10 days ago, we look like we've peaked and have started to come down. Fortunately, it seems like we're coming down in a more steep angle than the province as a whole is. So that hopefully bodes well for us here. This is from the Ontario Science Tables daily dashboard for Ontario, just showing the case trend over the past year. Or actually, it's not even the past year, over the past 5 or so months. Just want to flag here, I talked a lot about a few weeks ago how we'd see a decline in cases, it would flatten out and then would rebound as the variants of concern built up. And that's exactly what we saw, and I haven't kept going back to that story. This graph is showing the orange bars being the variants, the blue bars being the non-variant cases. And you can get just a sense of how much the cases spreading now are almost all variants. There's very few non-variant cases really left spreading in Ontario as a whole. I think also you can appreciate here how the line is not as steep coming down as it was going up. And if you were to, draw a trajectory going down, you can get the sense that we're probably in mid-June before we're getting cases to be a pretty low level. Hopefully there'll be the opportunity that this might trend downwards and we'll get to a lower level earlier. But based on the rate the cases are declining right now, I think it's looking like in mid-June before we get even into sort of the red or orange level of the provincial framework in terms of overall case numbers. Just on the topic of variants, I'm going to quickly show what the situation here is in Niagara. And this is a new page that's been up on our website since last week. And you can see from this curve here, the blue bars are the variants, and you can see the variants are really making up the majority of our cases. We've calculated here that if we take this 7-day period here, it's about 60%. I think there's actually a bit of a reporting delay still with these last few days we're using. And so it's probably actually closer to 70–75% of the cases here in Niagara are actually variants. And we can see that most of the variants are the B117 variant. We do now have one confirmed P1 variant, and that number of tests on screening, which look like they're either the P1 variant or the B1351 variant, continues to go up a little bit, but fortunately it doesn't seem to be going up very rapidly. I do suspect most of these will end up being a P1 variant, just given how much the P1 variant seems to be overtaking the B1351 variant in Ontario. So looking at where things are headed, this is the Ontario Science Tables modeling of what's happening with cases. So the second wave was there, this is the third wave, and the yellow trajectory is a trajectory we're currently on. The province will lift the stay-at-home order according to the current schedule in mid-May, and you'll see cases continue to decline for a little bit as the effect of that wears out, and then we'll see cases actually rebound up. And according to their modeling, we'll come back to a point pretty similar and actually slightly higher than the peak of our second wave. And I think we all know that this third wave has not been one that has been sustainable for our hospital sector. So this is not really looking like it's a viable option. And so there's, I think, two possibilities that can happen. One is that rather than lifting at stay-at-home order in mid-May, it's going to need to be extended to a later period. That'll allow cases to get lower, more vaccinations to be out there, so that once cases do rebound with the stay-at-home order lifted, they can't rebound to a level that's going to be unsustainable for our healthcare sector. The other option is that rather than delaying the stay-at-home order, we intensify the measures we have in place to reduce the spread of COVID-19. And that's what this green line is proposing. And it's talking about having things like sick pay, reducing the number of essential workplaces, so nudging more people to work from home, reducing people's mobility out and about in the community, and continuing to vaccinating in high-risk communities. And if we do that, we can drive cases much lower by the time the stay-at-home order is lifted. And while cases will resurge a little bit, they won't resurge nearly as high. I do think it's notable, though, that the cases will come back and plateau at a level that is probably double of where they were in late February and early part of March. So it's still going to be a pretty significant number of cases if that is done. And I think probably an ideal scenario is to get on something close to the green trajectory and also extend that stay-at-home order longer so that we can have cases very low by sometime in June when the stay-at-home order is lifted. And then when cases rebound, they won't rebound nearly quite as high. Just taking a look at hospitalizations in the province here. This has, of course, been the big story of this wave and why this wave has been so severe. And we can see, fortunately, it looks like hospitalizations may have also now peaked and are starting to maybe come down in the province. So that's certainly welcome news because we know our hospitals have really been at a very dangerous level. When we take a look at ICU admissions, it's perhaps not quite as good a news story, but still good in that it looks like the increase in ICU admissions has stopped and we're starting to plateau. And hopefully that'll start to trend downwards in the near future. The modeling for ICU admissions does kind of match what this shows. It shows that we would start to plateau in the end of April, start of May, which is exactly what we've seen. And then we get onto the yellow trajectory of ICU admissions very slowly starting to come down and remaining actually really high by the time we are in late May, which is when that stay-at-home order would be lifted and we'd start to see things rebound a little bit. So that's another reason I think this yellow trajectory, the current trajectory, is probably not sustainable. The green trajectory does better. It brings the number of people in ICUs down, but still actually has them much closer to where they were in sort of the early part of March rather than as low as we had them, sorry, early part of April, which is when our CUs were already starting to be stretched, as opposed to where we had them in March or February when things are more sustainable. So, I think this is another reason I feel that we probably need to see the stay-at-home order extended so that this number can come down to a level that is more sustainable. The province used to talk about 150 people in ICU as the danger level, and you can see we are well above that and would be well above that even by the end of May on the current trajectory, or even with the enhanced measures put in place. And so I do think the stay-at-home order is going to need to be extended and is going to be extended for quite a while. This is a table put out by the Ontario Science Table, which I just thought was interesting to illustrate how much by the early part of April our hospitals, especially in the GTA, were being stretched. And you can see how many people were being transferred from one hospital to another. And this is looking at people being transferred from an ICU to an ICU or from an acute care bed to an acute care bed. So people aren't being transferred to get a higher level of care in a more specialized hospital. They're basically being transferred to get the same level of care in another hospital, probably because the hospital they're in no longer has capacity to just have those patients. And you can see by that early part of April, hospitals were starting to do a lot of these transfers because they were becoming overwhelmed. And again, if we only bring ICU numbers down to where they were in the early part of April, based on our current trajectory, that probably means our hospitals are not sustainable at that point. So something more intense, something longer, or a combination of both, I think is really going to be needed in the province before we're able to reopen it. So I would not imagine the stay-at-home order gets lifted until probably once we're into June. This is a quick look here at what cumulative hospitalizations and cumulative ICU admissions have looked like in Niagara. And the good news is that we've peaked in terms of the total number of people hospitalized, and it looks like that number is starting to decline a little bit for Niagara Health. And with people in ICUs, we seem to have flattened out and are maybe just starting to see it coming down a little bit. So that's certainly good news. I think Niagara hospitals were never stretched as badly as parts of the GTA were, and it looks like we are getting out of a danger zone earlier than some of those other hospitals have. I think, our hospitals have had about 20% of these patients have been people from outside of Niagara. So we've been one of the areas that's been receiving and helping out some of the hospitals in other regions. And so even despite that, we were able to accommodate that as well as absorb the impact on hospitals in Niagara. So that's very good news here. This is the province's data on people spending time outside of the home. And of course, part of the lockdown was to encourage people to stay home. And we can see we've seen that mobility come down and people are now actually staying home much more similar to what they were during that second lockdown that we had. And that's partly why we're starting to see the positive trend in terms of our cases. They highlight that in some other areas, such as retail and recreation, it has come down quite a bit, though not quite as good as the second lockdown. People using transit has come down, though not quite as good as the second lockdown. But what they really highlight here is that in workplaces, there's been a small decrease of people being out of the home at work, but actually it hasn't been that much of a difference. And they're proposing that there can be more done here to reduce the number of people being out in the workplace. And that's partly the thinking I think that they had when they proposed that reducing the number of essential workplaces would help get us on a trajectory where cases come down more quickly and hospitalizations come down more quickly by lowering the number of people who are going to be going out and spending time at work. Taking a look at the data here in Niagara, this is people out at workplaces in Niagara. And I think we've done maybe a little better than the province as a whole, where our number of people who are in workplaces is not too dissimilar from the second wave, not as low as it was in the first wave. So there is more that could potentially be done here. The shopping and recreation data I've often showed in the past, and we've seen that actually has come down quite a bit more. So that's good news. We're starting to get close to where we were during the second wave. And then finally, if we take a look at people staying home, we can see people are staying home more, not as much as during the second wave, but I think that might be okay because the weather's nicer, people might be spending time outdoors. And as long as they're spending time outdoors with their households, that's something I think we can encourage. And that's hopefully going to make it easier for people to weather the rest of this lockdown. Now I want to quickly switch gears and talk a little bit more about vaccination. And so this is the vaccine coverage data that we have in Niagara as of the end of yesterday. So we are over 36% of Niagara residents have been vaccinated. The province put out a press release this morning, on Sunday morning, I think it was, saying that, or Saturday morning it was, 40% of adults have been vaccinated in the province. And in Niagara, our data is over 43% of adults, so people 18 years of age and older have been vaccinated. When we look at the total population of Niagara, including everybody down to the age of 0, which is what we've traditionally done here, we're at a little over 56%. And you can see in those elderly age groups, we still have very good coverage, and those numbers continue to creep up a little bit. We've made progress with the 60 to 69-year age group, where we now have 2/3 of that group vaccinated. And the 50 to 59-year age group, which was open for vaccination late last week, we already have almost 45% of them vaccinated, and about another 15% or so of them in the queue to be vaccinated. So we're making good progress on this group. Later this week, probably Thursday, based on the province's press release yesterday, the 50 to 54-year age group is going to open for vaccination, and we're already starting with about 30% of them vaccinated. So hopefully we'll see that number start to grow quickly as well. Now, a few weeks ago, I showed you this graph talking about what the Ontario Science Table had talked about, taking an age-based approach to vaccination versus combining an age-based approach plus additional vaccination in high-risk postal codes, and showing that cases would be further reduced if vaccinations were prioritized within those high-risk postal codes. And it would impact actually even the eldest groups, where the elder group would be receiving vaccinations regardless, but even they would see a reduction in the number of cases that they would experience. And some other data by them has shown that this would also reduce hospitalizations, people in ICUs, and people dying of COVID-19 by fairly substantial percentages. And so I talked about how I was expecting that given all of this research, the province is probably going to shift to vaccinating more in hotspots, which might mean there might be a little less vaccine in Niagara here. The good news here is, I think we're seeing that playing out a little bit. These are 4 strategies the Ontario Science Table put out here. This was a current strategy where 75% would be allocated per capita, 25% would go to hotspots. That 25% gets concentrated to just 20% of hotspots, so a little bit more concentrated in this scenario. Splitting 50-50 here and splitting 25 and 75% going to hotspots. And what they're showing is you could get coverage within your areas within hotspots a bit more quickly. But I think the real data here is that within these scenarios, you see more cases prevented and more deaths prevented by moving to those scenarios where you're vaccinating more in hotspots. And even, if you look here just at hospitalizations people in ICUs. Again, more vaccinations are sent to the hotspots at the expense of other regions. You'll actually have more people prevented from being hospitalized and more people preventing from going into ICUs. And so the province has adopted a version of this as of last week. So you can see we were on a 75-25 split with 25% going to hotspots last week. This week and next week, 50% of vaccines are going to be going to hotspots. But rather than this being actually done at the expense of every other public health agency, the province is seeing a doubling of vaccines coming in. And so what they're doing is they're just taking all of the additional vaccine coming, giving it to the hotspots so that the rest of us actually are staying flat in terms of the amount of vaccine we're receiving. So that's good news. It's meaning that there isn't going to be a reprioritization of vaccine away from us. It'll just mean that the additional vaccine coming is going to be reprioritized to those hotspots. The other part the province announced, which I'm sure you've all seen, is a more rapid progression through the different age brackets and through the different phase 2 priority groups for vaccination. So by the end of the month, everybody will pretty much be eligible for vaccination if they're 18 years of age and older. A couple key things I do think should be highlighted about this is, first off, the province has said the week of May 3rd, the week of May 10th. So this morning, all of these groups didn't become eligible for vaccination. Only this 18+ group in the hotspot did. The rest of these groups are going to become eligible at some point this week. We don't know when. So I think they put out a press release saying it'll probably be Thursday. So it'll be sometime in the week, probably Thursday, and future weeks, it'll be sometime in those weeks, and we don't know the timeline yet. Just so there isn't any confusion, because I think a lot of people assume that this would mean May 3rd, it's open to everybody, May 10th, it's open to everybody. It only means that week of. The other part is that people will be eligible to book for vaccinations on these dates. There's not necessarily going to be vaccine appointments available. So in Niagara, if we look at all of these people, it's about 200,000 people becoming eligible for vaccination over the course of this month. When we look at the amount of vaccine we're receiving, it's less than half of that. And so if we have high uptake for vaccination amongst these groups, there's probably not going to be appointments in the latter part of May for them to be vaccinated. They'll absolutely be able to book an appointment, but that appointment might be several weeks away. And so people need to be aware of that they're getting the permission to be able to book for appointment, and that's great news. They'll know when they're getting their vaccine, but it doesn't necessarily mean that they will be getting that vaccine right away. So with that, I'll stop and turn it over to questions.
Had to reclaim host. Okay, thank you, Dr. Hergy. So first up for questions this week, we have Ludwig. So give me 1 sec and I will allow you to unmute. There you go.
Thank you, Meredith. Hello, everyone. I can't really say I have any questions at this time. Thank you. Maybe in the second round if there's time for that. Thanks.
Okay, excellent. Up next, we have Richard Harley.
I also don't really have any questions at the moment. Thanks, though.
Okay.
Hopefully that means I answered everything.
Way to go, Dr. Hergy. Up next, we have Penny. Let's see. Penny, do you have any questions?
Yes, I actually do, although it may be one that Dr. Hergy has already answered and I just didn't get that. I'm trying to think, okay, so you said that there are 200,000 people in Niagara left to be vaccinated. You're not expecting that you'll have enough vaccine to get that done by the end of May. Although the province is saying everybody 18 and over will be allowed to be vaccinated. Could you give us a percentage of how many people in Niagara you think could be vaccinated by the end of May, given how much vaccine you know you're going to have?
I would ballpark it that it'll be around 55 to 60% of people will have been vaccinated by the end of the month.
Okay, thank you.
We've been doing about 5% a week over the last little while, so I expect that'll continue. So that'll get us to between 55 and 60%.
And a follow-up, Penny?
would you expect that to be in line with the provincial targets, or will we be below it because other areas will be getting extra vaccine for the hotspots?
Yeah, I would expect places like Toronto and Peel will be higher because they're getting so much extra vaccine. How that does to the Ontario average, I'm not entirely sure. I expect us to be well in line with their other peers who aren't in the central part of the GTA in terms of what percentage of our population will be vaccinated, though.
Okay, thanks, Penny. Up next, we have Gord.
Thanks. Dr. Hergy, it's a question again about hotspots. L2G in Niagara Falls was designated 3 weeks ago, I'm gonna guess, maybe longer. It's hard to tell these days. Maybe I read this wrong, but looking online today, even in Niagara, L2G is only about the 6th worst for positivity rates. L2W in St. Catharines, West St. Catharines, seems to be a lot worse. Am I reading that wrong, or should the province be a little more flexible in designating hotspots?
Yeah, I haven't taken a look at the most recent data, but it's certainly consistent with what we've seen around L2G being above average, but not the highest in terms of cases or hospitalizations. L2W, we've seen pop up as high positivity some weeks and be really low in other weeks. So I'm not sure I'd necessarily say it's the highest consistently. It seems to be variable week to week. I do think the province probably should have labeled the L2H forward sortation area as a hotspot. That has very clearly been by far the highest in terms of cases and hospitalizations that we've seen. And I'm not really sure why the province didn't do that. There was an article in the Toronto Star a couple of weeks ago looking at the designation of hotspots, and they concluded the same thing, that L2H should have been a hotspot based on what they saw from the provincial data, and for some reason it wasn't. In terms of the very more flexibility, I would certainly welcome having flexibility that we could designate some local hotspots as based on our local knowledge here, and that could hopefully correct some of what the province has done. That opportunity doesn't really seem to have panned out the way as maybe hinted initially, then maybe it would.
And a follow-up, Gord?
I'm sure you've heard this too. There's been a lot of calls from certain groups to allow things like golf and tennis, even skateboard parks that can be distanced, to allow them to be reopened. Do you think they should be?
I'm open to it. I think there needs to be a bit more discussion around that. And there would need to be some restrictions. So going golfing, I would say you can go golfing with your buddies, because now you're no longer, sticking to just your household. You need to have some restrictions that you're out golfing only with your household. You're playing tennis only with your household. But if you do that, then I think it should be fine. Outdoor activities we know are much lower risk than indoor activities. This probably makes it easier for people to sustain the stay-at-home order, to allow some household activities outdoors in these kind of recreation areas, and allow them to continue to stay at home otherwise through to June, which is when I think this will need to extend to. So I'm certainly open to having some restrictions lifted there. I think you just need to be thoughtful that it's not completely open, that we have some limitations, but I think there's a way we can do it.
Thanks, Gord. Up next, we have Stephen.
I have no questions at this time. Thanks, though.
Okay, thank you. And up next, we have Bonnie.
Hi, everyone. Thanks again for hosting. My question has to do with a follow-up. We talked about this last week, Dr. Hirji, about kids going back to school physically before the summer. Yeah. And so you said last week that there would be a reasonable chance that children would go back in maybe late May or June. After seeing what's happened over the last week, how do you feel about that? Are you still as optimistic?
Yeah, I'm not sure if you'd say late May or early June is optimistic or a little bit pessimistic. I know there's some people hoping for children to return back earlier. I would say that's realistic, and I still feel that's likely to be the best, likely to be the way things play out here. If I'm looking at, the Ontario case curve, or maybe actually let me jump ahead a couple to this one here, 4 weeks takes us down to a position which was similar to maybe mid-March in terms of the number of cases we have. And I think at that point, that was something that we, at least in Niagara, were able to sustain in terms of following up with all our cases, isolating them, making sure we're figuring out what's happening in schools and able to keep them safe. I think once we got into the early part of April, it was becoming very difficult to stay on top of all of the cases in schools. And I think if we can get cases back down to that sort of level of where they were around that time, I think we'd be able to reopen. And 3 to 4 weeks does look like a realistic timeline to get it down to a manageable level again.
And a follow-up, Bonnie?
Yeah, the federal government has approved vaccines for 16 plus, but Ontario is only approving people for 18 plus. Do you know the reason behind the difference?
I don't know the reason behind the difference. I asked them about this and they said that an announcement for opening up to 16 and above would follow at a later date, so after the week of the 24th, but I didn't really get a reason why they decide not to just make it 16 and above. Just to note that the only vaccine approved for 16 and above is the Pfizer vaccine. The other ones are all 18 and above.
Thanks, Bonnie. And up next, we have Paul Forsyth. And Paul, sorry about the technical issues earlier.
Can you hear me?
Yes.
It might have been on my end, I don't know. Thanks, Meredith and Dr. Hergy. I apologize if I'm going over something you've already mentioned. I'll have to watch the video or the audio when it's available. Do you think these anti-lockdown protests, could they actually have the reverse effect of what the organizers hope? In other words, by having people gathered without precautions, could it actually extend lockdowns and end up hurting our economy even more?
There's certainly the risk that that potentially could happen. When you have a big gathering like that, there's potential for infection to spread. If more infection spreading, there's going to be more cases. There would be more hospitalizations. Anybody there who gets sick, who then takes it back into their home, takes it into their workplace, could spread more infections there. So yeah, there's absolutely the potential that those activities will, undermine the lockdown and actually lead to more cases and more hospitalizations and need for the lockdown to be extended. I don't know what the probability of that is, but it's certainly possible.
And a follow-up, Paul?
Yes, and there obviously are people out there who believe lockdown measures don't work. I mean, since Ontario has gone into lockdown, again, you may have mentioned this today, but the data, I believe the data has trended to make things, and to improve the situation, I believe, that getting us out of this situation eventually.
Yeah, we had a lockdown last spring that kept cases low and brought it down. We had a lockdown at the start of this year that caused our cases to peak and come down. We've had another lockdown. We seem to have peaked and are on our way down. That is real world evidence that these lockdowns are working. As painful and as difficult as they do seem to work to bring COVID-19 under control. We have the experience of many countries around the world that have done the same thing, and lockdowns have worked everywhere to bring cases under control. Places which are avoiding doing lockdowns right now include places like Brazil, include places like India, and we're seeing how bad things are there in terms of cases, in terms of hospitalizations, in terms of just the sheer number of people dying. Even south of our border in the United States, where many states were resistant and dragged their heels with doing lockdowns and putting measures in place, we've seen how much higher the number of deaths they've had for COVID-19 have been. So, I think it's incontrovertible that lockdowns work. I think there's a reasonable debate around, the severity of lockdowns and what is the balance of lockdown measures versus having certain freedoms to, not harm the economy as a result, and finding that balance. I think there's a, openness to have some debate around that, but I think in principle, a lockdown prevents cases, prevents hospitalizations, prevents deaths. We've seen that over and over again.
Thanks, Paul. Okay, so we've gone through one round of questions. If folks have another question, please let me know in the chat. Okay, I see Ludwig, so I'll unmute you. There you go.
Yes, thank you. It just struck me what I was going to ask. It's about the extension or potential extension of the stay-at-home order. So I was just wondering if you could return to that. It sounded like you said that the trajectory that we're on, it looks like the province intends to do it mid-May, but you advocate for a much longer one. So how long? What do you see need happening? And yeah, could you extend on that, please?
Yeah, so the province, currently the stay-at-home order extends to mid-May. It's certainly an option for the province to renew it. I think that was a somewhat arbitrary date set. From what I'm seeing here, if we're seeing cases come down, it's going to still be pretty high in mid to late May. I showed the modeling earlier that shows that cases will rebound on our current trajectory if we reopen in mid-May. And our hospitals are really not going to hit a lot of relief by the end of May. And so I don't think it's a sustainable point to reopen on our current case trajectory. It's hard to really predict how long it needs to last. I do think it needs to last probably to early to mid-June, probably. There's modeling put out by the federal government, which I talked about last week, showing that once you get up to 75% of the population vaccinated with one dose, that will probably be enough to keep cases under control. And realistically, we could get to 75% probably by mid-June. So I do think that becomes a more realistic time where we can lift the stay-at-home order. Ultimately, though, I think this needs to be decided by conditions on the ground. So what are the number of cases we're dealing with? Is that something that's low enough that public health is going to be able to do really detailed contact tracing and really keep cases under control through that? And our hospitalizations low enough that our hospitals are no longer in danger of being overwhelmed, they're relieved, and they have some buffer room. So if something does go wrong and cases go up, they have the ability to absorb those hospitalizations without being put in danger. I'd say those are the two big things to be looking for. What are the cases? What are the hospitalizations?
Okay, and Gord, you had another question?
Yes, it's maybe a little more big picture, I guess, but if you look at the deaths in Niagara, they've occurred about 50% more often in women than men. Is that typical everywhere? And then has that ever been explained?
Yeah, I've seen some data showing that it's perhaps been more men than women in some other parts of the world, but it hasn't been consistent. And so not sure what the current worldwide trend is. In terms of why it's been more women than more men in Niagara, we don't have a great explanation for it. One observation is that there are far more women in long-term care homes and retirement homes than men. And we had big outbreaks in long-term care homes and retirement homes. Most of our deaths occurred in people in those settings. And so that probably is why more women passed away as a result. Why there's more women living in these settings than men, I'm not entirely sure. Perhaps women, we know their life expectancy is longer, so maybe they have managed to stay alive and remain in those long-term care homes a bit longer. And that's why they were around, unfortunately, when COVID-19 struck.
Okay, and Bonnie, you had another question.
I do. Dr. Hirji, I guess one of the popular activities for children and families right now is going to the outdoor playgrounds. Mm-hmm. Is it safe for families to play on these outdoor playgrounds? And if so, what kind of precautions would you ask them to take? Obviously, social distancing and all that kind of stuff, but should families be wiping down equipment with wipes before they're playing on it? Just kind of give me an idea of how safe it is and what kind of precautions you would suggest.
Yeah. I think what you talked about in terms of keeping distance is the absolute most important thing. So find a part of the playground where your child and other children in the household are able to play together without really interacting with children from other households. That's the most important thing. Increasingly, we'll find that the risk of a surface being contaminated with COVID-19 is a relatively low risk for infection spreading. It does happen, but it tends to happen only when you've been in contact with the surface very soon after someone else has been in contact with it. And so, in a playground, I'd be less worried about that. There's also the benefit of sunlight, which naturally disinfects surfaces out there. So I wouldn't be too worried about wiping down surfaces. I think it would be sensible, though, to caution children not to be putting their hands in their mouths, just to make sure whatever they're touching, they're not then ingesting. I know kids do that a lot. And if you're able to try and encourage and police your children not to put their hands in their mouth, that would, I think, be a sensible thing to do. And I think it'd also be sensible that after they finish playing in the playground, give them a little bit of hand sanitizer or let them sanitize their hands. So if they did touch anything, that is gone and they're going to be safe. But I think with those simple measures, play only with your household. Don't stick your hands in your mouth. Use some hand sanitizer after you're finished playing. I think it's pretty safe to be out on playgrounds.
Okay, and Stephen, one more question for you.
My question was answered, so thank you. That's okay.
Okay. All right, thanks everyone for joining us this week. If you have any follow-up questions, please send an email to Courtney, Carrie, and myself, and we'll do our best to get them answered. Thanks a lot.